Hello and welcome to another episode of the Health Notebook. Today we're discussing childhood respiratory tract infections and we have Dr. Walele once again in the studio. Dr. Walele, welcome.
Assalamu alaikum wa rahmatullahi wa barakatuh and good day to all the listeners.
Dr. Walele, we're discussing childhood respiratory tract infections. How common is childhood respiratory tract infection and what is a childhood respiratory tract infection?
Okay. Childhood respiratory tract infections are extremely common. I don't believe there's a single parent worldwide that hasn't experienced a child with a respiratory tract infection. So it's very common. However, the majority of them are self-limiting, but there is a subgroup that requires attention, and hopefully the focus of this chat will bring out that particular group which requires that attention. So worldwide, very common.
Okay. Can you maybe just highlight what causes a childhood respiratory tract infection? I know you get viruses and bacteria. Can you just elaborate a little bit on that?
Right. The first point to mention is that when we talk about respiratory tract infections, is that you have what's known as the upper respiratory tract and the lower respiratory tract. In the main, the upper respiratory tract infections are fairly self-limiting. In other words, they get better on their own. However, the focus today would be on the lower respiratory tract infections, which is commonly called pneumonia. And there are other sections to this as well, but these are the subset of infections that require a little bit more detail.
Okay. I know viewers tend to get confused between a common cold and influenza. What is the difference between the two?
Common colds are caused by a large number of viruses, and most of them get better in a couple of days. Children as well as adults might find that they are a little bit feverish, have a snotty nose, might be coughing, and feel a little bit down, and thereafter they get better. Influenza is a virus. It comes in a very severe form sometimes. And this is the danger. Influenza really makes you sick. It gives you high fevers, gives you rigors, it gives you a cough. It sometimes can lead and worsen a lower respiratory tract infection as well. And generally speaking, you feel symptomatic for a week or upwards.
Okay. So we clearly defined it now into the upper respiratory tract infections and the lower respiratory tract infections. What are some of the signs or the symptoms of a lower respiratory tract infection?
That's a good question, because parents need to be aware what to look for in their children. And this particular topic I am actually limiting to little babies upwards to the child, and excluding newborn babies, because they have a different clinical presentation. So if you look across the spectrum of age groups, one of the most important things that will happen is your child will have a high fever. The second thing that they will have is what we commonly call respiratory distress. In other words, you will see the child breathing heavily. You can often see that the rate or the speed of breathing is increased.
So the chest would move up and down
a lot faster. Sometimes you can see them sitting up and using their body muscles, especially in the chest, to try and maintain that breathing almost up and down as we go along. And cough is also a very common presenting symptom.
Okay. Just to touch a little bit on cough, would you say that that is sort of a defensive mechanism or just a little bit behind the cough?
Correct. Cough often worries parents a lot, and rightly so. But however, one has to note that cough in fact is the body's defense mechanism to get rid of mucus, to get rid of the inflammation, and also to get rid of the infection with time. Cough can be very persistent, and sometimes you do have to do something about it. But if your child is coughing and can cope with it, just allow them to actually naturally cough up whatever is happening, to get them on the healing process as well.
Okay, so you've touched on the signs and the symptoms of a lower respiratory tract infection. What red flags are there to make the viewers say, okay, I need to take my child immediately to the medical practitioner? So can you just highlight a few red flags that makes viewers aware of, okay, it's time now to go to see a doctor?
Right, this is a very important question, simply because both viruses as well as bacteria causing lower respiratory tract infections, commonly known as pneumonias, they can have a number of danger signs which have to be flagged and should prompt a parent to seek medical attention as quickly as possible. These are namely a child who is extremely lethargic and tired, and you can see that from a child's demeanor. They will be coughing, they might have a very high fever, they might be not be feeding very well, especially in the lower age groups from 3 months up to a year. Then they could also display a symptom called cyanosis, commonly blue around the lips, and they might actually display a variety of other symptoms which prompt you to actually go to a doctor. But I think if viewers just remember 3 cardinal symptoms: a high persistent fever that's unremitting. In other words, you have tried whatever you can, but the fever doesn't come down. Secondly, a child who goes blue. And thirdly, a child whose respiratory rate is high or increasing. And finally, a child who you think is becoming sleepy, lethargic, and pretty unresponsive unresponsive to his or her surroundings.
Okay, so now the parent brings the child to you. What's your next step?
Right. We very much encourage parents to seek medical attention if they have diagnosed or self-diagnosed their child, simply because your healthcare professional will have a variety of means of actually ascertaining the severity of what he or she faces in front of them. Now, if you take your child to a doctor, a nurse, or someone similar, the most important thing is to listen to the chest, because if we find a variety of signs on the chest, this could indicate to us the extent as well as the severity of the infection that your child is facing. Now, doctors can do many further investigations beyond that, including blood investigations, chest x-rays, and a couple of other things like monitoring your oxygen concentration in the blood. And these are all indicators which will allow them to discern between the child that can be sent home and the child that needs to be hospitalized.
So that is sort of assessing the severity of the respiratory tract infection. Okay, so now you've made the diagnosis with all your investigations. What treatment options are available?
In general, we divide this up into supportive treatment and then specific or therapeutic treatment. Now, the supportive treatment could be to manage the fever, in some way to help alleviate the cough, and in terms of therapeutic management, often antibiotics do get used for chest infections. There's a little bit of a difficulty here because we know that both viruses and bacteria cause chest infections, and sometimes you actually get a mixture of this in your lower respiratory tract. So your doctor may choose to give an antibiotic under these circumstances, but it depends very much on their clinical judgment at that point in time and what other else supportive evidence they have. So antibiotics are used, they have benefit, and they will lead to your child getting better and sooner. Yeah.
Okay. Just to touch a little bit on that point. So we have one disease or lower respiratory tract infections, and they are caused by the viruses and they're caused by the bacteria. So what you are saying is that you don't need an antibiotic to treat a viral infection in certain instances. Is that correct?
If I have to give you a short answer to that, you are correct. For a viral infection, an antibiotic will not work. However, in the lower respiratory tract, there is often a mixture of viruses and bacteria that interplay with each other, and these obviously then require an antibiotic. However, depending on the severity of what your child is experiencing, your doctor might opt to give an antibiotic of different classes and natures, depending on what he or she believes is the correct one.
Okay, so the doctor will provide an antibiotic. What are some of the other medications? What about something for the cough, something for fever? I mean, would you advise cough medicine as well, or?
Yes, managing the fever is particularly important. Although fever is the body's reaction to an infection, and a high fever from a really research point of view proves that it does help to improve an infection outcome. Fever is in particular a very worrying symptom to parents. So fever does get managed quite aggressively and should be, because it does make your child feel better. In terms of cough medications, there are a variety of them out there. The one set or class of cough medication that is not advisable to be used are called the antitussives. Now, these are cough medication that are used to stop a cough. They have little or no place in the management of lower respiratory tract infections. The opposite is called an expectorant, and sometimes this gets used with a mucolytic. Expectorants are actually a cough medication which allows you to cough easier and brings the sputum out, and this helps in clearing the infection. The mucolytics are used simply to thin out the mucus and allow easier coughing, and sometimes they are mixed together.
Okay. So we've touched on the medical treatment. What about the non-medical treatment in terms of physio? Does chest physio add value? As
far as I am concerned, the chest physio has got benefit, and this is mainly in the hospital setting. So there are cases few and far between that can be managed at home, sometimes with a home program. These are for patients that might have a prolonged cause for their cough, but in general, if you have an acute lower respiratory tract infection, it's best to manage it with chest physio in the hospital setting only, and that's where it does add a little bit of value. Yeah.
Okay, so how can respiratory tract infections be prevented or reduced?
It is difficult to stop the spread of a respiratory tract infection, as we all know, but there are a couple of parameters which can be used, namely that first of all, hand hygiene is very important. So washing your hands, because some respiratory tract infections are transmitted through bad hand hygiene. Cough etiquette is extremely important, and preventing others from being the recipient of your viruses by managing cough etiquette properly is particularly important.
So this also applies to the context with adults as well, because we're not only looking from child to another child or child to child transmission, but it can go via other individuals as well.
That's correct, because it's important not only for adults to manage their cough and their cough etiquette. You should also teach your children to do that in the presence of others as well.
Okay. And in small babies, just one or two important points to suspect respiratory tract infections in small babies, or yeah.
The basic answer is that the smaller you get, the more vigilant you should be in seeking medical attention, because the outcomes are worse and the danger signs are worse. So the main things in smaller babies are high fever. Sometimes they even have an inability to cough because of their tiredness. They can also have respiratory distress, like we described earlier. And very importantly, they have poor feeding or persistent vomiting as well. So that particular subset, I believe, especially if your baby is under 3 months of age, you should preferably seek medical attention under any circumstance.
Okay. Just touching a little bit on another topic about whooping cough. Does that still exist?
Yes, whooping cough does exist, and it's actually increasing worldwide. And the reasons, therefore, are mainly because the bacteria is becoming more prevalent. Sometimes it's because of refusal to use vaccines or ineffective immunization programs or things like that. But however, it does still exist, and we do see it in South Africa. And we are actually increasing our surveillance regarding whooping cough from the National Institute of Communicable Diseases.
Okay, so we've touched on quite a wide variety of issues pertaining to lower respiratory tract infection. Moving slightly off the topic again is, how valuable is the use of honey at night?
Right, there have been certain scientific reports and journal articles coming back and on the effectiveness of honey in the alleviation of nighttime cough. And certainly this is something that I can advise to children above a year of age. There are a couple of provisos. You do not use unpasteurized honey, for one. And secondly, it is best to stick to the well-known honey products. So the off-label or sometimes even the imported honeys are not advisable, because we don't know what the credentials or the background of that honey production is. So what I often advise parents, especially if there's a nighttime cough or post-nasal drip, is to actually take some honey, thin it out with a little bit of warm water or a little bit of lemon juice to mask the taste a little bit, and give it to your child at night. It's very effective.
Okay, no, that's actually very good advice as well. We've spoken about lower respiratory tract infections. You gave me one or two of the diseases that it may present as. What about tuberculosis or TB? What are the signs and symptoms in comparison to a lower respiratory tract infection?
In our setting, in the Western Cape, in South Africa, and the rest of Africa, TB is a very prevalent. It's still a deathly disease, and certainly needs to be recognized. So although I wouldn't include it per se in the acute lower respiratory tract infections, I think it's very important to discuss it. TB in children does present as a chronic or prolonged cough, especially the older you get, the more likely you are to have this scenario. But it also presents in a very sneaky way. It presents with your child perhaps losing weight. Sometimes you do get night sweat, but that Road to Health book or Road to Health card that children get from the state and private clinics are essential to monitor your child's growth. And TB doesn't stick to the lungs, unfortunately. It goes all over. So the lungs are probably one of the primary sites where you would get TB. Now the second thing is about the cough per se. In tuberculosis, the cough can be quite prolonged. So it's unlike the cough that you would associate with a common cold or even with an acute lower respiratory tract infection, where it is pretty self-limiting. In tuberculosis, it will last for upwards of a month.
Okay, so what should one do then? Should you go and see your medical practitioner, and what will actually be done then if they do suspect TB?
If you do suspect TB, the first question to ask yourself is, who and where is the contact? Because children, in the majority of cases, would get tuberculosis from an adult. Now, once you suspect that, then you should have a higher vigilance for that diagnosis. The best way to do this is to actually go to your local clinic or to go to your doctor and ask them to investigate you for tuberculosis. There are a couple of things that we often do. In the under 5s, we would give a little skin test, and we monitor that after 48 to 72 hours to see if it's growing. Then we often check by means of a chest x-ray, and if we do see the telltale signs of tuberculosis, then we can often make the diagnosis and prove it by asking for a little bit of sputum or sometimes even some gastric juice.
Okay. So can TB be cured?
Definitely. One of the most impressive things is successful treatment and cure of tuberculosis. And that requires a lot of emphasis from parents and a lot of cooperation from parents to ensure that their child gets the full course of TB treatment over the full duration. Okay. We know it's long, but TB grows slowly, and we need to make sure of two things. One is that your child is successfully treated, and secondly, whoever the contact is, to actually treat the contact and make sure that TB does not get spread to other individuals as well.
Okay, so we've spoken a little bit about lower respiratory tract infections, we've spoken about tuberculosis, and to end off, I'd just like to ask you about flu vaccinations. How effective are those in children?
Flu vaccines are extremely effective, whether they get used by adults, children, or pregnant women. So it is advisable at any given time, prior or early in the flu season, to actually give the flu vaccine, because there are a couple of concepts related to this. The more people you vaccinate with the flu vaccine, the higher the effectiveness of it, percentage-wise. So if you want to protect your family, don't just immunize your children, immunize yourself too. Okay. And if you can immunize your community, even better.
Okay. Dr. Walele, it's been a pleasure having you in the studio once again. We look forward to seeing you again in future episodes. Thank you very much. Thank you for watching. Stay tuned for another episode next week, same time, same place.